just to give you a little bit of an outline of how we think about social and why we think it's important, is that we want to start with really how marketers traditionally think of social media, which is just a company saying stuff, and then people either love it or they really hate it. And especially in healthcare, there's a lot of just imagining one of these two scenarios in which people say, "Hi, I'm this business," and then people are like, "Yay," or "Boo, I hate that." But it really doesn't work that way at all. That's not how social operates. And when we look at what social does for audiences and for networks, really, and we'll talk about that more and more today, is that it's understanding, it's helping people by helping them understand what kinds of conversations to have. And if you think about how healthcare happens, it's really through a series of conversations, whether it's people talking to each other about how to understand what it is that they're feeling, or how to get that treated, or what to say to your doctor, or how to start that conversation, because so many conversations, and we'll talk a little bit later about conversations that are really uncomfortable or unusual that people don't have. Like, we don't typically talk about our health in a real concrete way. And without social media to be there and help us practice what those conversations are, most people just don't understand what a real health outcome looks like. So they go to their doctor doesn't necessarily want to or even know how to have the right kind of conversation, and they end up not really getting treated well, especially because so much, and especially in the U.S., so many people live in what we would consider C and D counties, where there isn't really a specialist available to them. And maybe it's the doctor that's been seeing them and their family that's 30 or 40 or 50 years removed from medical school. And so social media is actually a real way for people to find those connections, to practice, or to see what the right conversations are to have, and to be able to have those conversations and to find real support and real community in ways that I think surprise even us as marketers, because especially traditional marketers don't walk into social that way. They think of it as a marketing channel and not like an actual place where they have the opportunity to deliver healthcare. And one of the ways that we can really understand how these networks operate is because they're digital, those connections are happening right in front of us. So this is actually a network map of what the CF community looks like that follows the Cystic Fibrosis Foundation. So if we look at that, it's not a singular audience, right? Just like you sitting here watching us. It doesn't work like that for the Cystic Fibrosis Foundation. It's actually a series of smaller groups that are actually connected together to some degree. And understanding how these groups operate and how they connect together is what makes a network strong, and actually leverages what we call the network effect, which is that it can actually send messages and help people get healthy beyond the sum of its parts. So if you think about all the nodes of this network here, which seems fairly complex, each of the dots in this map, it connects to 250 other people. And there's actually one brand that came to mind that has done this like especially well, that I think a lot of people can relate to even outside of the healthcare space. And that person or that brand actually this fall broke a sales record by moving 4 million units in a fairly stagnant industry over 12 weeks' time. And they did it really off of what was originally a mistake post that was trying to make people fearful about something as simple as marijuana. So it started out with this post on Tumblr in which someone posted a picture of their friend Becky, who used to be happy, popular girl until one night she snorted marijuana at a party. She died instantly. Please don't do marijuana. It's the most dangerous drug out there. Don't wind up like Becky. Does anybody know this story? So this isn't Becky. And so the next comment on this post was someone identifying the fact that this is actually Taylor Swift's high school picture. To which the person that posted this responded back, "No, it's Becky." So Taylor Swift's new album, 1989, is about to come out, and it's out now. It came out in the fall. I'm in the time of the story. So this post in and of itself became kind of an open secret among this network, right? Among the network of people that follow Taylor Swift. So this got reposted over 30,000 times. And if you think about each person, again, representing a network, how many hundreds of thousands of people actually were exposed to a mistake, right? So in the views of marketers, this would seem like an awful thing that we would have to try to combat, this idea of our identity being messed up or someone else representing us incorrectly. But really, what Taylor Swift did was to wear a shirt that says, "No, it's Becky" on it. And then posted to her profile an alternate cover to her album with the shirt that says "No, it's Becky" on it, to which that piece of content actually got almost 100,000 reblogs, right? So if you think about that representing a much wider network of people, this is someone that represents a brand that understands how to engage the network on its own terms. And I think what we'll talk about today is really the opportunity that exists for the brands that we work with in healthcare to actually engage the network. And when you do that on their terms to help them have a healthier perspective, you'll be amazed at the kinds of outcomes that can happen. So actually with that, we will love for everyone on the panel to introduce themselves. Pat?
I'm Patricia McWilliams. I'm with Google and YouTube. I've been part of the healthcare team for about 8 years now. And was saying just earlier, I think we are at an inflection point right now in terms of adoption of social media by healthcare companies. So it's a very exciting time.
Hi, I'm Ryan Billings. I'm the Director of Social Strategy at AstraZeneca. I've been there for about 8 months, and before that I was at Merck for 3 years and worked in social across a few other industries, including the entertainment industry. So I'm a big Taylor Swift fan as well.
Hi, I'm Peter Engelman. I work at a social listening and analytics platform called Brandwatch. I work with great partners like Digitas Health and brands to make sense of all the social conversation and start kind of getting those granular insights that lead to gems like the Taylor Swift conversation.
Got it. Oh. Hi, I'm Rickon Diwan. I am Branding Creative Strategy Manager at Foursquare. If you're not familiar with Foursquare, Foursquare is an app as well as a website that helps you find places that you love in a personalized way. And we also have another app called Swarm where you check in and keep up and meet up with your friends. My role is really to make sure that brands and companies across various different industries and verticals are not only using our ad products in new and creative ways, but that we're also creating experiences for them that leverage our data about the places people go and why they go there in the first place.
My name's Samantha Arabolu. I work at Digitas Health in our social group. I've been here for 7 years, and I've worked across a number of conditions, across categories and clients. And I'm also an avid user of Foursquare, Brandwatch, Google, and the entertainment industry.
You're a super user.
Yeah.
Basically, you're a super user. So just to start our panel conversation, I thought it would be great to begin basically with how we always start to understand what the network is of a condition, and that's through social listening. And I think there's been some really interesting findings that Brandwatch has recently had in terms of looking at a space that we all, I think of ourselves as familiar with, and one of the areas that social listening becomes so valuable is when it surprises us and shows us a network of people behaving in a way that we may not have known before. So you want to talk a little bit about the work that you've been doing?
Can we pull the slide up, please?
Yep.
So just as a point of reference, Brandwatch is a listening platform, and when we talk about social, it's much more than just your Facebook, Twitter, Foursquare. We're actually looking at blogs, forums, sites like WebMD, all these niche communities where patients are having conversations, journalists are having conversations, healthcare professionals are having conversations. So what we're able to do is pull in all that content and start trying to identify what people are saying about medical conditions, about fear of being diagnosed with a certain medical condition, or even tracking a patient journey. If you go to the next slide. So just to kind of put some context around it, we did a study looking at HIV treatment and the conversation around HIV. The general thought would be that people really aren't going to be talking about their process of being diagnosed and going through that life cycle of HIV. But in fact, what we were able to do is identify, if you go to the next slide, please, that there's a lot of different groups and audience members that are talking about this. So for example, we see that the largest amount of people talking are journalists, and this is all conversation about HIV treatment. So the main content drivers are journalists, and that oftentimes is taking place on news and blogs, as well as Twitter. Whereas you see patients make up about 24% of the conversation, and then you have all these other individuals who are contributing as well. So what's compelling is you can start looking into each of these different author groups or these different segments of the population talking about HIV and HIV treatments, and you can start garnering insights about what the main points of conversation are, what's their emotion, and what is really going on in their mind. Next slide, please. So one thing that I think is really interesting is you see a huge amount of conversation about people talking about the likelihood of passing on HIV. One thing that we're able to do is determine that people that have HIV who have put that out there are much more keen to talk about not necessarily curing it or that long-term solution, but they want to manage a relatively normal lifestyle, and they also want to make sure that they don't transmit that disease. A couple kind of anecdotes here. We see some quotes on Twitter, which you wouldn't imagine, as well as blogs, which you wouldn't, kind of think that people would be forthright with posting that, but you see people talking about that it's really not, the curse that it used to be of living with HIV. And that can start kind of giving the brand or the agency or whatever the person is that wants to target these audience a better understanding of their thought process, their mental state, as well as how to direct messaging to them. Next slide, please. So this kind of dives into it a little bit more. You can see that the individuals that are patients are much more likely to talk about living with a normal life, whereas you have journalists talking about long-term care or remission. So the conversation of curing HIV and living with it is very kind of polar opposite between journalists looking for this holy grail solution, whereas you have people who have contracted HIV more concerned with how to get on with their life, how to live a normal life day to day.
And that's actually a perfect example of the difference between what happens in mainstream media and what happens in social media, right? Is that you have people writing a story, right? And that story actually ends up being fairly consistent from one outlet to the other, because they have norms, right, that they're kind of adhering to even unconsciously. But the conversation that's actually happening among people is far more diverse and actually way more divergent from the story that's being read in the press.
Yeah, absolutely. So going beyond HIV, what we also have had a lot of success with using social listening tools such as BrandWatch is to identify disease states and what kind of symptoms people are speaking about different types of diseases. So if you go to the next slide, we can identify the sources and the locations, so Facebook, Twitter, forums, etc., where people are more likely to talk about different types of disease states, which can help with messaging and social strategy in terms of identifying when and where to interact with these people. And we've had a lot of success with our healthcare clients using social listening as a means of research to pull out insights like this, which then helps drive messaging strategy, but also you can start looking for things like adverse events, things like recalls, and there's a lot of insights that you can do just by merely listening and seeing what the conversation is out there. It's a really effective way of, basically it's market research in an unbiased fashion where you can start pulling in this data at scale and really start having that play more into the strategy.
One of the ways that we've used this data at Digitize Health really effectively is not just to go out and say, all right, here's platform by platform what the conversation is, but to look at it from this point of view first of who the people are and what the topics are that they're interested in, and then go across networks to say where that kind of conversation and that kind of person is happening, which is interesting because as you think about, say, the core personas that make up a disease state, one of the things that we find is they will have different conversations, and we'll touch about this more in a second, based on where the identity construct is happening. HIV is one of the places that we actually saw a ton of conversation on brand new platforms like Whisper, because it offers that anonymity. And actually, we're not going to look at that right now. But as we talk about kind of broad listening that can happen there. I think, obviously there's nothing broader than Google, right? Everybody, reaches there first to find out more about, say, their health. But I think it's really interesting the point that you were brought up about just the wide range of people that you're seeing and what they're searching on.
Just to provide a little bit of sense of the scale, one of the ways that we understand things at YouTube and at Google is to obviously look at the data, but then we also have a lot of very large survey tools that we can deploy. And if you think about the fact that there are 3.5 billion searches on Google every day, and that 1 in 20 of those searches is about people's health, you get a sense of just how ubiquitous it is, people looking for health information online. In fact, it's one of the top things that we do when we're online. And so across YouTube, if you were to go today and look for virtually any type of rare genetic disorder or widespread conditions such as diabetes, you would find thousands upon thousands of videos of people either sharing their story of going on treatment or sharing their story of being on medication. And there's literally something for everyone. So in trying to understand better what are people's motivations, we've done surveys both of doctors and of patients, people living with chronic conditions, and said, how do you feel about using social media? What are your motivations for using it? Nearly 80% of people living with a chronic condition say that they use social media to find other people living with conditions like them. 40% of them said it's extremely important to their life. And when we look at that study combined with other studies, the things that emerge are the top 3 reasons that people are using social media is, number one, well, actually, the reason they're connecting with people on social media, they tell us, is to find hope. That is the number one reason. They're seeking patients like themselves, and they want to find hope. The other 2 reasons that they're looking for are to find other patients like themselves, get information about treatment, but then also just to live with chronic conditions. And interestingly, when we survey doctors and we ask them about using online video and sharing it with patients, the things that they're looking for are along the same lines. So it's very much along the same lines. Doctors, general practitioners are looking for a lot of video to share with their patients about living healthier lifestyles. Specialists are looking for more information about treatment, like rheumatologists looking for how to inject and things like that, which makes perfect sense.
Yeah, that actually brings up a great point that a lot of times in a lot of traditional media, when we do planning, we look at the choices that we make as marketers in those media as either or. Like either we're going to invest in this medium or we're going to invest in that one. Either we're going to have this message or we're going to have that one. But I think the dynamic nature of just the way social is developing is that those choices are not as clear. And in fact, it's often like what we call the and economy instead of the or economy, that you'll actually see different segments of patients or doctors and doctors look for different things at a decent scale. And I think that's one of the interesting things that you've seen, Ryan, both in terms of how people reacted to branded settings, but also what people say introspectively when you ask them directly about what they're interested in one-on-one. Do you want to talk a little bit about what's happening at AZ?
Yeah. Do you want to? Is this on?
I'll bring it up.
Yeah. So one of my roles at AZ is to consult with our top brands at our top markets, and one of our top brands is Nexium. It's for gastroesophageal reflux disease, aka GERD. And what's interesting here is this is a great example of doing social not just to do it, but doing it because it's what the patients wanted. And the brand really started, they did this in the right way. They started by listening to what their patients were saying online, and they found that people love Nexium. Sufferers of GERD, they talk about the product, how it's changed their lives, and there was no community for them. So these brand loyalists, we decided let's create a community for them. And we found that the patient actually skewed a little older in age, was female, that was the demographic, and so it made sense to launch a Facebook community. And we launched a Facebook community after a lot of red tape and hurdles, as you can imagine, because the community actually has open comments, which is a first in the industry for a brand in pharma. So a lot of, getting through all of that, but it's really was worth it in the end, because just you can see like the patient engagement that we're having from the brand talking directly back to the patient. A lot of great feedback. So that launched in late November. We have about 140,000 likes already, but even better, we have above average engagement. But I think the point is that, patients finally have a place to come together and to talk about suffering with GERD, because it is not a lightly taken disease like you would think. Go to the next, maybe to the next one. Yeah, so here's some of the content. Most of it is around kind of more unbranded lifestyle types of content. It does usually tie back to the condition. So we'll talk about recipes that can help people that have GERD. But occasionally we will do a direct kind of promotional post, and we've figured out how to balance that with taking into account the FDA draft guidance and stuff like that. But it is possible to launch a branded community and to see positive engagement on it and actually help patients. So it's been really cool to watch.
But it's one of those things where, amazingly, like we always talk about, like we think, or we have the perception that people don't necessarily want to talk about a drug, right? But actually, for this patient audience, that wasn't true at all. They want to talk about the drug. They want to talk about their experience with it and how great it's been.
Mm-hmm.
Yeah.
And even when we put up, say, a recipe, they'll start talking about the brand. Like, we can say anything and they'll start talking about the brand, because the name of the page is Nexium Esomeprazole Magnesium, which is the brand. So it's pretty great in that way.
But so we see other patient segments that are not as interested in that, and you talk a little bit, because you had a great experience recently in London where you got to talk to some patients.
Yeah, so we went to London. So like I said, we're a global team. Went to London and heard from a patient. He was the 11th bowel transplant patient in the UK. Very low survival rate, so it was really cool to actually talk to him, have him in the room. And I asked him straight up front, I said, what do you want from pharmaceutical companies? Because he's very engaged online. He Skypes with his doctor because he doesn't feel like driving an hour and a half for an appointment just to get his blood results. So he Skypes, and his doctor texts him, and he said, he has that great relationship going with his HCP, but from pharma, he said, I do not want another community from you guys. He's like, I built my own community with my friends and my colleagues, my peers that I've met online. I have that support. I don't need you to launch one for me. So I think that was, one person's opinion, but he is right. He's built up his own community, but then you do have instances like Nexium where people do want a community. So it really depends.
Yeah, and then there's the other instance where we have, disease states like ulcerative colitis or HIV that are highly stigmatized, in which we see this, I put together this really quick chart here of this new kind of spread that we're seeing in social media, in which not only are we seeing, the Snapchat gain a ton of momentum, just because it's got that lack of permanence, but we're also seeing platforms like Secret, Whisper, thank you, Sophia, and Yik Yak even on college campuses pop up because they are completely anonymous. And even though you do get really silly conversations on there, you also see just these massive communities around these stigmatized areas like ulcerative colitis, where people don't feel comfortable having that kinds of conversation or that kind of content tied back to their identity, or like binge eating, which is kind of like an offshoot of the pro-ana discussion, but also even in condition areas that maybe aren't that great to talk about. You see people on Tumblr really aggregating around that content. So in the same social network that you think of, having 500,000 tagged conversations around moms, you have a whole completely different network of people that are aggregating around content about HIV, or aggregating around content about binge eating, or aggregating around content around. I mean, one that you've done specifically is Movantik, which is incredibly niched.
Yeah, so we have a launch product for OIC. Does anyone know what that stands for? Because I didn't when I signed up to help them. Yeah, opioid-induced constipation. So You would think, so basically opioids are painkillers. So people who are on painkillers experience a really life-changing side effect of constipation, and they can't do the things they normally want to do, but they don't think about that when they go into their doctor's office and get prescribed a painkiller, and the doctor doesn't always bring it up. So if you look at the patient journey, I mean, they try all sorts of laxatives and over-the-counter things, and it doesn't work because that's not how the brain, I'm not very scientific, but the way that the brain like talks to your digestive system when you're on painkillers, so the over-the-counter stuff doesn't work. But I worked with that brand team to think about what can we do with social, and we assumed that patients would not want to talk about something like this because A, it's so niche, and B, it's kind of embarrassing. But we did social listening and found there is no place for them to talk about it, and there's no news source about it. There's no place for them to get information about it, but they're talking about it in random places like the New York Times health blog. They're talking about it in the discussion forums. So we decided, A, we need to build a news hub for them, and B, we need to build a community because there's no place for them to talk about it. So I think there are special instances of, I guess, for lack of a better word, embarrassing conditions that people are willing to be advocates and talk about it online and find support. So that's been a great experience as well.
So this is actually a great segue to talk a little bit about our MS Lifelines community, one that Sam has really been powering, another first in terms of Pfizer's ability to have open commenting in a branded community.
Pfizer and EMD Serono.
And EMD Serono, right.
Right. So this is an example of a community that is made for a specific condition, multiple sclerosis. And when we look at multiple sclerosis, the condition, it actually is a broad range of demographics from younger to older people. And some patients diagnosed with multiple sclerosis are actually limited physically and can't do a lot of the things that they used to do. So when we created this community, we knew that MS was a social disease. We actually knew they're already active on a lot of communities across social media, because there are some, to Ryan's point, there are some communities where they already have an active community where they don't want any input from pharma. So there are forums where they are already communicating with themselves, but in multiple sclerosis, these conversations are a little disjointed. And we realized that there was an opportunity to kind of bring hope and inspiration to this community. So this New York office actually created a page that has done immensely well with really great content that touches on what these people wanted to hear. And I think what was most surprising is that of all the leading association communities that they can go to, a large group of these people diagnosed with multiple sclerosis actually engage with our content and with each other. And what's very surprising is how personal they have gotten in their communications on this public platform. I know I expected people to kind of say support or support each other or ask questions, but the level of engagement.
Yeah, just small talk.
Just small talk.
Yeah, it's
Just small
Facebook.
talk.
It's just
Yeah.
it's a small talk channel.
The level of engagement we saw as soon as we launched was incredibly flooring for me. There were people that were very, very optimistic and lighthearted, but then there were people that would share the horrible stories about how their husband left me because they were disabled, about how their children don't talk to them, and I honestly didn't know what to say. We didn't know what to say as a brand, but what's beautiful about this community is that they talked to each other and they supported each other with similar stories. And they look to our content to kind of start positive stories, so you'll see them sharing and thanking people based on things we create. And it was really an eye-opening experience to understand the conversation that people are having and how we, as marketers or even as people that want to support them, can participate as long as we understand what they're doing and how we can help.
And again, it's a great example of what's valuable to a network is not, and I think is another mistake a lot of marketers make when they think about social media from a marketing point of view, is they think about about engagement, like as though people are engaging with the brand. But that engagement's really a means and to an end that is people more effectively engaging with one another. So our best job of community management is actually effectively positioning the brand in a place where it can be the setting for people to get to know each other and be able to support each other where we're not doing the talking, which is really the case with this with this community, and it's the content that allows them to talk to each other and to create those connections. And it's the content that also helps us to really manage their behaviors in a way that no other medium can help to manage the behaviors. But just a few examples here of how tight this community is of people that really didn't know each other before they met.
Met each other online. You'll see people that actually have started to recognize each other, and they comment and reply back to each other just like they know each other. And this is actually something you see across a lot of patient communities, especially in niche conditions. There's really people forming relationships online that they wouldn't be able to form in real life like this.
Yeah, another great example is what we see in cystic fibrosis. So because of the suppressed immunology of cystic fibrosis, and because it's mostly kids, social media has offered these kids the ability to meet each other for the first time. Is that really in real life and before social media, these kids would never be allowed to be in the same place at the same time because of fears that they would get each other sicker. But now what social media actually allows these folks to do is to get to know each other and to be a community in a way that they could never actually be a community before, which is really amazing. And the last thing I wanted to touch on, and not to leave Rick in here without anything to say, but how important it is to and what a powerful position that we're in as brands, representing brands in these spaces to help people literally get healthier through behavior management. And that's why I wanted to bring Foursquare here, because I think what Foursquare is tracking, while it seems like a awesome recommendation engine for restaurants or a place to check in so you know where your friends are, is actually much, much more than that under the hood.
So actually, maybe we could bring up that video. But Michael brings up a really good point. I'm trying to find out where to put my water bottle. If you aren't familiar with Foursquare, over the past 6 years, we launched in 2009. We've had 7.5 billion check-ins across the world. We have 65 million unique places. A lot of apps that you might know of, whether it's like a Waze or even Microsoft and Bing and other apps like that, integrate our API to understand places. We really feel like we have the best understanding of where people go and what they do, but in the real world. And I think a lot of what we've talked about is social and communities, and those are awesome. We actually have a lot of social kind of features and functionality in our apps and offerings as well. But one of the things that we can do is we've taken, actually, if you just hit the space bar or play, this is a map of New York City, and we're just taking our top categories here. So, and looking at check-ins into those things. And it might be hard to see, but it's at 9 a.m. and people are checking into offices and different things like that and residences. But we can actually see over time and throughout this day, this is about a year composite of data, exactly where they're going and what they're doing in the trends. And I think this data trends is something that we'd love to talk to brands more about, especially in this category, in this vertical, to see what are some of the innovative things that we can learn from these trends. And these are just top line. Now we're actually comparing it to Tokyo in this one, and we have this across the world. And actually this is about over a year ago that we created this. And we did this with check-ins at first, but as phones got smarter and the technology that we carry is getting smarter, we're actually able to do that without needing someone to check in, and making it much less evasive, much less in that mindset of, oh, I'm at a restaurant, let me check in. Well, no, maybe you just went to a Duane Reade or a CVS, or maybe you were at a park or a gym. You didn't necessarily want to check in, but we're still able to understand, okay, what is this person's behavior in the real world? That video is a great example of us doing that on a macro level. But we've talked about this a lot. There are opportunities to create an opt-in experience. So one that I mentioned before, my job is really to find and create new ways for brands to tap our data. And I think this is one of them, where how can we create an opt-in experience where I'm saying, hey, I have a condition, or I actually want more access and reveal more about myself to get some type of utility and vantage point from a brand, or we've done it with brands across entertainment, CPG. We actually did a campaign with Pepto-Bismol last year as well, and when you check in at restaurants or you're at a pharmacy as well. But it would be amazing if I could opt in and say, hey, I have a certain type of condition. Can you look at my behavior? Can you look at my trends? Does that tell you anything? The other thing we do is we have, in 2014, we launched a new feature called Tastes. So as you use Foursquare, instead of just a recommendation engine of where you should go in the world, it's personalized. So I can say, hey, I like spicy ramen, or I like kale salad, and I can actually get recommendations based on my different tastes that I have. So every time you open up Foursquare, whether you're in a restaurant or just roaming the world, we hope that you versus the person next to you has a very different recommendation because of this taste and this personalized layer that we're building. But if you think about a condition like diabetes, especially like type 2, can we look at that taste? Can we give recommendations? Can we look at a patient's profile of taste and say, hey, there's some consistency here, or maybe these are things that you should change, or hey, we'd recommend you adding certain taste based on the condition you have, or different things like that. And that way, we create a much more kind of seamless way of going around the world without kind of inhibiting on somebody, but able to give them recommendations and a new way of exploring the world around them. I think we talked about this a little bit. Not every condition allows people to leave their homes and make use of that. But I think a lot of this can benefit, a wide range of conditions. I have asthma, and I'd love to know, like, where is it good? And people can leave tips and put a hashtag against that. Brands can also come on the platform and leave tips, and I think that's really powerful. How can we're creating great content in the social world and online, but how can we make that available to someone when they're actually at a place? And we kind of have the pipes and the platform to do that.
Or when they're about to get to a place. So
Yeah.
I use the example of, how great it would be. So there's a ton of tracking that happens, right? But and there's a ton of optimization that happens. So using a tracker to have like a better basketball shot, or using a tracker to do better form when you work out. But for someone that needs to get into the habit of walking more, or someone that needs to get into the habit of being more active, I think that those kinds of check-ins and that kind of data availability lends itself to be able to tell someone just before they're about to do the thing that they always do, to say, what if you did something just a little bit different today? So we use the example of like the Starbucks. Like, people stop at the same coffee shops every single day. What if Starbucks knew that there was another coffee shop on your way to work that was just 3 minutes, but 250 steps out of your way? And if you add those up, every week you would be doing, more than 1,000 extra steps than you would normally do, and start to build those new kinds of routines out of what you're already, predisposed to doing, and building those new healthier habits in ways that really meshes those technologies together to understand. One of the things that I think us as marketers fall into the habit of, really unfortunately, is trying to amp up your motivation, or trying to understand what motivates you, why you do something, as opposed to how you do something, right? And really talking to in social and using technologies like Foursquare is how to do the things that you're motivated to do, instead of just trying to tell you that you need to do more of it.
Yeah, and I was just going to say one thing. I think this year, today Pebble announced a new watch. We all know Apple Watch is going to come out. These technologies, I think the data and the tech is finally going to catch up with something that you said. Like, the mainstream media might be looking for the halo cure for everything, but the patient just wants to live their daily life and return to some type of normalcy. And I think with this data and tech, we're going in a direction that can do that now. So.
Well, I think with that kind of concludes the conversation that we had planned on happening. Does anybody have any questions with our last 10, 15 minutes? Sure, go ahead. Okay, so your first question is doctor oversight of sponsored forums or social forums, and the second part is government oversight of these forums.
So the approval processes in pharma is kind of insane. So part of that, aside from legal, regulatory, compliance, all of that, you also have medical affairs who has to approve everything. With the case of Nexium, every response that we give back as a brand, we have about 600 crafted responses. They're all canned, but you can't even tell because they look personalized, and we've thought of every scenario under the sun. If there is a medical event that's reported, we have someone 24 hours a day, every day, looking through the community, a community manager. They're trained on adverse event reporting, and we're getting more than we thought we'd be getting, but that's that's the nature of a branded open comment forum. But we definitely have a process in place for that. So, and what was the second part of the? Oh yeah.
The FDA is. Yeah, the FDA. Sorry, I was like the FDA actually also has their own kind of listening mechanism, and I'm not sure what they're doing with it because I don't work for the FDA. But I think that they are finally understanding that these conversations are happening, and there's things for them to learn on social media. So I think there's oversight into what pharmaceutical brands are doing, but also they're listening directly to the communities themselves, and medical oversight in terms of physicians. I think that's a really interesting subject because we also look at what physicians are saying online, and I think we have some insight into what they think of patient conversations. And there's definitely a divide where, and correct me if I'm wrong, but some physicians are just oblivious to the fact that these patient conversations are happening until somebody walks into their office and says, I read this, this, and this, like this is what I think I need. And that actually starts a dialogue with physicians. And I found that some physicians are more open than others to kind of incorporating that patient, the patient proclivity to find that. There's also some forums where there are nurses and experts or Q&A with medical professionals. So if it's not necessarily a doctor, because they have very busy lives, some are set up so that there are nurses that aren't actually community nurses. They're just nurses that are active in the condition. And so they present themselves as moderators to kind of monitor the flow of what's happening.
What have you noticed as far as like hospitals and like healthcare providers participating on social media? Because I think we heard a lot about patients, and we heard a lot about pharmaceutical companies. So I was wondering, how should, large hospitals or hospital chains or maybe even insurance companies, do you have any insights about how they approach social media?
Hospitals are actually very, very active, I've noticed, in social media. And the really large networks like Cleveland Clinic, Mayo Clinic, Sutter Health, they all have really huge presences in social media. And I think insurance companies too are getting there. Pharma is actually, I would say, third, sorry us. But hospitals and insurance companies are very active, and they have a great way of engaging with patients. If you go on some of their sites, I think what they've been really good at is unbiased educational information from their own physicians. So what you see there is that in Philadelphia, where I'm based, there is the Hospital of the University of Pennsylvania, and a lot of hospitals like them are actually using their physicians in their own hospitals to promote their business, but also provide advice to patients. So you'll see really high quality video about a physician explaining condition. And I forget which network it is, but there's actually Google Hangouts where you can watch a bunch of physicians discuss the latest topic or a popular treatment, and they'll record it. And sometimes you can actually participate live and ask the physicians questions yourself. So hospitals and insurance companies are doing a really good job at leveraging social media.
I'm just going to add to that. One of my favorite cases in healthcare is actually Aetna, and they've done a really good job of reformatting their content strategy to the Affordable Care Act and educating consumers on what that means. And they've really great engaging content on that. And they also do really great customer service, which blows my mind because they're in a regulated industry, and they respond within 3 hours to patients on both Facebook and Twitter. I've had claims dealt with over direct message. It's really easy. It's better than picking up the phone. So I always give kudos to Aetna. They do an awesome job. And then I've seen other insurance companies take a content approach just around like lifestyle stuff, recipes, etc. So I think there's a lot of good cases of insurance companies doing social.
We have definitely seen adoption of Hangouts between patients and doctors, and generally speaking, most doctors that are open to using it are finding it to be a very positive experience. I think what is still the frontier or the opportunity for pharma companies is to use Hangouts for detailing, because if you think about what an incredibly efficient way that could be accomplished, that's really an untapped opportunity.
My name is Setu Arande. I'm with the News Corporation, the Post, doing a story on medical practices. And the question simply is, what do you have in the community right now that networks people that don't want to do traditional but non-traditional homeopathic type remedies? So you network the doctors globally that's involved with non-traditional with other physicians and patients in the hospitals, that type of a network, global network. Does it exist, or?
I think that's happening in niches. I think what actually is the opportunity that that I think networks are trying to tap into now is actually getting people to just see the specialists, the traditional specialists, that could have a tremendous impact on their life and their health outcomes. That actually in this country is a really interesting startup called Grand Rounds. And what they found is in this country there is a 1% that's happening in terms of people that work in the medical industry, and the outcomes that they're able to get from the healthcare system, as opposed to most everybody else that's engaged in the healthcare system, and that they typically just see a doctor and do whatever that doctor says. And what they're finding is through social networking, they can actually get your medical records to the number 1 or number 2 specialist in that field faster than anybody thought. That typically those people have been in very remote areas. The people that need the specialists are usually in big cities, and that the specialists are thought of as really busy. But the truth that they uncovered is that what would take your general practitioner in a place like Nebraska or in a place like Louisiana a half day to read and probably not correctly diagnose actually takes a specialist in their field at that level between 3 and 7 minutes to diagnose, and to actually radically change the course of treatment and the outcome that's available to that patient. And in fact, they've seen in the patients that they've helped a 65% overturn rate in terms of changing the course of treatment that was originally diagnosed and saving about $10,000 per patient in terms of the treatment that requires. So I think it's startups like that are having a really tremendous effect on changing the traditional health system. But I think the non-traditional health systems are just growing their own types of organic communities in places like forums and in Facebook groups, just naturally. I think that that what's interesting is when that line blurs between non-traditional and traditional, where you have people kind of approaching the healthcare space like a retailer, and especially in the absence of traditional approaches, what you're seeing is that whoever has the loudest voice is the one that gains the widest audience and is seen as kind of the expert in that field. And I think that that's something to look out for as we continue to mature the space.
Kind of an unformulated question, so let me sort of find my way through it. So, oh, sorry. We traded. We keep talking about, in all of your context, you've been talking about patients, and we're talking about categories and disease states and specific things, right? But pretty much every patient is a person, and pretty much every person is a patient at some point. What I'm wondering is, what's the bridge of how to support people as part of their social dynamic, as they're interacting with each other, and as they're exploring health issues, whether they have them or a friend has them or a father has them, or they start. How does a person become, who's active in social but not necessarily active in health social, how does that person get into the patient community process? How can we talk to them, or how can we support them from the business of social media, from the in sort of transcending their, or translating their ability to communicate in social as a person to their ability to communicate as somebody with a condition?
So I think that's where actually it becomes super important for brands to model what that behavior is, because I think, to your point, a lot of people just don't know, right? So they'll search, they'll use a tool like Google, they'll search. I think more and more we're seeing Twitter be a valuable place of search. I think the Google, Twitter collaboration is really an interesting one, especially when we see very few markets, South Korea being one of them, where Google doesn't have penetration, because there are kind of already hybrid services that exist there, like Naver, where what you're searching is recommendations from other people instead of pages. And I think it's really up to the brand. Like it's actually falling to us as marketers and as brands to actually help people in that way, to model out, like, what do you do? What is the conversation that you're supposed to have, or what is the way that you should be approaching or searching this space to figure out what it is you're going to do? Because I see where you're headed with that, and that is that people just don't know. So, you know, I've been referring to it in terms of health outcomes, but you're saying the other thing, which is tremendously valuable, though. It's like, you don't even know the health inputs, right? You don't even know, like, where to start or how to say it. And I think that we so often overlook those things. Just like as marketers, we always kind of look for scale instead of looking how to model the conversation that you have just between two people, or just among three people. And it's actually understanding those dynamics is what ultimately drives scale, right?
So I know we've been talking about like the current state of where everything is in terms of people utilizing chat rooms and utilizing message boards, about the types of conditions that they have. But I guess my question to you is, like, all that stuff is happening now, and that's great. But is there anything that you guys see on the pipeline coming down, especially with, you know, the Apple Watches coming out and Fitbits becoming really more of a mainstream type of technology? Is there anything that you guys can foresee coming down the pipeline that will actually change the way we, pretty much as Americans, utilize the healthcare system? Like, will we all be kind of just formulating our own patient care plans and telling our doctors that's what we want to do because we read about it in the message board, or we saw it on Wikipedia, or we Googled the statistics and got a research document PDF and read through it? Just because now people have access to so much more information than they ever had before. I feel like HCPs aren't looked at as, well, you know, in some ways they are, but your general practitioner is no longer looked at like the be-all, end-all of my healthcare. I can now take it in my own hands, and rather than saying I'm going to go with this treatment plan, I read about something else that maybe sounds more appealing to me. So I guess that's my question. Like, are we becoming more individualized in our care plans? And what else, what future technologies have you guys been reading about that's just kind of exciting, and you're kind of excited to see how that changes everything in the social media medical field?
Yeah, I think you kind of answered your own question. Like, we're becoming so much smarter, and it's so, like, it's patient empowerment, right? I mean, just being out in San Francisco earlier this year, seeing a lot of these health startups, like there's one called AliveCore, where it's an EKG you take with your iPhone. It sends directly to your HCP, and like from a pharma perspective, we're thinking, oh my gosh, what can we do with all this data? Like, are we going to be buying it? And like, just there's so much that we can do to better understand the patient and to better treat them. And does anyone else have other answers to that? Maybe from a Google?
I think I would echo Ryan that I think we are in the middle of a big transformation, and it's going to be just more of the same. Everyone is going to be incredibly well informed. We are going to be seeking personalized medicine, and we're going to have devices everywhere telling us everything about our, you know, health and our stats. And, you know, hopefully it'll lead to overall better health. Time will tell. Behavior modification is the hardest part, but at least we'll have the data.
And I think that's the transition, is one, going from seeking your doctor as an expert to seeking your doctor as a collaborator, and getting that data to the point of insight. I think those are the two big things, is that we have no shortage of data now. What we do have is an utter lack of insight into that data, so that either we can present it in a way that makes sense to that doctor, because that doctor is only seeing us and doing diagnostics on us now for maybe 10 minutes out of the how many minutes comprise our year in which we could be tracking everything and feeding that kind of information back to a doctor. But the problem is we don't have good ways to gain insights from that data, and we also don't have good ways to provide that data to the doctors in a way that makes sense to either their training or their specialty. And that's what was exciting about seeing, startups like Grand Rounds, AliveCore is another one, looking at health algorithms in a new way. But basically, what that points to is that we're looking at a world that will start to develop methods around all this data to actually make it valuable to the way that we live. So I think that's it. But thank you so much to our panelists, and I know I speak on their behalf to say thank you to all of you for joining us, and I hope that this was helpful discussion through social media. So thank you very much.